I'd like to welcome Melissa and Aaron here tonight, and I'm going to let them introduce themselves and we'll get started. So, Melissa.
Hi, I'm Melissa Enns. I am a therapist at Mindwell Center, and I am a school social worker in the Ithaca City School District as well. I practice under my LMSW license, so I'm a social worker by practice.
Thank you.
I'm Erin Alexander. I am also working at Mindwell Center as a therapist right now. I am in the process of working towards my PhD in clinical psychology. So currently I have my master's and I'm doing supervised therapy with other psychologists on staff to get that training, and I will have my PhD soon. So that's my background.
Good for you.
If I could share screen, I don't have access to screen sharing right now.
Oh, whoops, hang on a second. Oh, that's not what I want to do. Okay. There, you should be able to do it now.
Yes, okay. Okay, can everyone see the slides?
Yes.
Okay. So Melissa and I are going to be talking to you today about demystifying mental health care, answering some of the basic questions about seeking therapy, what to expect in therapy, answering some of those go-to questions that people have, some of the things that hold people back from maybe going because they're nervous and don't know what to expect. So we're going to start by going through some of the questions, and then at the end we'll hope to get more of a discussion going and answer any specific questions you have. As we mentioned, we're coming from the Mindwell Center, which is an outpatient mental health clinic in Ithaca. It's a group practice, so there are several psychologists, social workers, counselors working there with different specializations in different areas. We treat adults, children, families. I have a couple couples cases that I work with. So really across the board, different levels of care that people need, different concerns that people are coming in with, and different populations. We have a lot of therapists who are able to help in many distinct different areas. And Mindwell is very focused on evidence-based care, which means that the therapy that we practice there is very rooted in what science shows helps. So we want to make sure we're delivering the kind of care that works and that is going to get people better as quickly as we can.
So given that, we thought this cartoon was a little bit humorous, because that's not what we just do, is have somebody come in and we say how wonderful they are, even if you are wonderful, which you all are. Why go to therapy? So there's so many reasons, and it's hard to narrow it down, but I think these were things that Erin and I hear the most probably from people and what we've known from our different experiences. So typically, if there's a mental health diagnosis going on, even if the diagnosis is not set yet, there are still symptoms of a diagnosis. So hopefully to reduce some of those symptoms, to understand for people to understand their mental health needs, emotional needs, and interpersonal relationships. Even if people are not coming for couples therapy or any therapy with somebody else, it's still a way to understand and work through some challenges that come up in different relationships, whether that's work relationships, familial relationships. And then obviously, we really work for people to be able to bring what they want there. So they set their personal goals, and we try to make these therapeutic measurable goals that we can work towards and see change, because our hope is therapy is helpful for people and not just something that is put on the calendar to kind of check off as something they feel like they have to do for any reason. Learning strategies is really important. And then there's also this time in therapy where you just explore some of your stressors, and we'll talk more about different practices. And sometimes it's just having a better understanding of what's going on for you, not necessarily getting rid of it, but owning it and it becoming, part of you in a positive way, and recognizing the positives with things that may even cause stress for you.
Yeah, and we know that there's a lot of overlap between physical health and mental health concerns. And so for things like pain, for things like coping with lifestyle changes, therapy can help with any of those overlapping areas between the physical and mental health that come up.
Yeah.
So this is a question we get a lot. How do I find a therapist? If somebody's starting to think maybe they want one, where do I even start? Where do I look? So there's a few different routes that I can recommend to try to find someone. And you could always just go with the standard Google search, but these are some more specific tools to help you find lists and specific people that you're looking for. So one good way is to get a referral from your doctor. So doctors are used to people coming in with mental health concerns, wanting to know more about therapy options. So a lot of primary care doctors or specialists in different areas have some therapists that they know of in the area, have at least an idea of what resources are available in your community, and might be able to get you a couple names and give you some options for some people to call. So that's one option. You could also get referrals from friends or family members, but you want to be careful around if it's someone who you're really close with, maybe having the same therapist could create some awkward conflicts of interest if it's, say, like you and your husband both seeing the same therapist and complaining about each other. So you could get referrals from friends and family for specific people who have worked for them, again, with that caveat there. Psychology Today website has a search tool where there is lists of all of the counselors, like psychologists, therapists in whatever area you're in. And that's a great resource. There will be a little summary that that therapist puts with their name describing their approach. It sometimes can give information on like whether they take insurance, whether they're accepting new patients. And so you can see a whole list of them with different bits of information to try to find a direction of which ones are going to work for you. And then there can be links to their websites there. So if reading through some of their little summaries, a few of them jump out to you as ones you might be interested in, you can go to those few websites to look in more depth at what those people have to offer. I like to tell people to use their insurance company's website because that is a great resource, and then you know that the person you're finding takes your insurance. So all different insurance company websites that I've looked at have some kind of find a doctor, find a provider tool where you can put like a distance radius, whatever insurance plan you have through that insurance company, and then what type of provider you're looking for. So you can put counselor, psychologist, social worker, whatever it is that you're looking for, and they'll give you a list of providers who take your insurance in your area. Of course, that's only an option if you have health insurance, but a great option if you do, so that you know whoever you're finding will take your insurance. Another good way for some populations, like if somebody's a student, often through colleges or through high schools and even elementary schools sometimes have a school counselor or school psychologist available. So if you have connections to a school or a university, you can often get care through that. Especially universities often have free counseling, so that is a great route to go if you have access to that. And if you're a veteran, you often have access to that care through a VA. So that's another option if either of those populations apply to you. And then Melissa has another resource that she knows about specific to this area. If you can.
Yes. So I put Collaborative Solutions Network, and if you look up that website, it's one word, collaborativesolutionsnetwork.org. The local website that was created by a group of providers in the area, people that do support work with families, children, adults, and they have a listing on that site of practitioners as well and other mental health resources in the community. So that's always a way to go. Tompkins County has Tompkins County Mental Health, which serves the community, that you can call right away and be seen. And we have some other bigger agencies in the community as well that can help. I was going to add with the connections through schools or the VA, a lot of local psychologists and social workers and counselors are on a listserv, Ithaca Therapist listserv, and sometimes they can help connect you to somebody with openings through that as well and put out a request to the community, the therapist community. Or if an individual reaches out to a person that they think could be a good fit, say they found them on Psychology Today, but that person has no space, they may also offer to do some reaching out on the listserv to see who has openings.
Mhm. And something else, we were briefly chatting about teletherapy before. One of the pluses of teletherapy is that you can see a provider who is potentially further away than you would be willing to drive. So if you're looking for options and right now you find somebody who's a little bit further away, that could be an option for you now. Now that might change as we start moving towards more in-person work again, but a lot more therapists are starting to have teletherapy options. So if you're not finding someone with availability right in your community, right now might be a good time to get connected with somebody further away who's offering teletherapy. Now, we've been using different terms throughout this talk already: therapist, psychologist, social worker, counselor. And what is the difference between all of those? Does it matter? That's a question that I know I get a lot. A lot of my relatives are like, "You're going to be a psychiatrist, right?" And I'm like, "No, a psychologist." And so the differences aren't always clear to a lot of people. So we wanted to just kind of highlight the differences in what these different types of professionals do, so that when you're looking for someone, you can know who you're looking for. So a psychiatrist is a medical doctor. So they go through medical school like other medical doctors do and have an MD degree. Some psychiatrists do talk therapy, but most psychiatrists today focus on medication management. And they will be the only one on this list who can prescribe medications. So if you're looking for options in terms of medication, a psychiatrist is who you want to be seeing. Though some primary care and family doctors will also prescribe medication. So that's another option.
Just to add, I was thinking about this as well. There's also psychiatric nurse practitioners who prescribe as well. So you may see that in the community too.
Yes, there's some good ones in this community specifically. There's a lot of the psychiatric nurse practitioners doing good work. And so psychiatrists have more of that broad medical training and tend to have a more biological approach in general. Again, there's variability within psychiatrists, within any of these different types of professionals, but they are the ones with that medical school training, and that's going to be the main approach that they're taking. They often do shorter appointments that are just the medication check-ins as well. So something to know if you're specifically looking at psychiatrists. Next option is psychologists. So this is the field that I will be working in. Psychologists have to have a doctorate. So that's usually 5 to 6 years of education after college. And there's different degrees that psychologists might have. A psychologist with a PhD has a lot of research training in addition to therapy training. So that would be the difference between a psychologist with a PhD and a PsyD, which is another kind of doctorate degree in psychology, is that the PsyD psychologists don't get as much of that research training. So again, more of a scientific approach to knowing how to both conduct research and perform therapy, whereas PsyDs know how to read research, know how to interpret and apply research, but not do as much research. So both are qualified professionals with a lot of training in psychology. And you might see also an EdD, which is another doctorate in psychologists. Those programs are, again, qualified doctorate level psychologists. Those programs are becoming a little bit less popular. Just there's a little bit more of an education focus in those programs. So psychologists have a lot of training, often are specialized in a specific area or two, but also have more of a general mental health training. And again, often have a more research scientific approach. And that is typically a 5 to 6 year program.
And I should add, these are not.
Melissa's going to talk about the social work.
These are not in any preferential order, just so you know. Can you hear me okay? Am I?
No.
Yes.
We're good? Okay. I couldn't tell if I was freezing. So what you might see after someone's name, if they're a social worker, that SW is the hint, the social worker at the end. There's an LMSW, that's the licensed master social worker. LCSW is a licensed clinical social worker, and a DSW is a doctorate in social work. DSWs are growing in the field. There were fewer programs as of like 10 years ago. So that's actually becoming more popular. At Mindwell, I know we have a DSW on staff. So our programs are shorter than the psychology programs. Typically a master's program is about 2 years, including field placements. We do lots of areas within social work. Some people have more of a clinical focus. Sometimes it's more a macro focus where there's more organization work, focus on family and children, sometimes substance abuse. So there's some areas of focus within an LMSW, within an MSW program. And if somebody's able to do the counseling, they can have an MSW like that qualifies for that. And LCSW means that they've done and had more supervision around their clinical license and their clinical experiences and taken a test. Some of this is a bureaucratic thing. I will say that, like my LMSW, I have to pay and I have to renew and I have to get training every 3 years. At this point, I could have my LCSW. I haven't done that next step with that test or that payment. So they're both, really important. And honestly, what a lot of it is about is how they can bill more than how they can provide. So all of these can equally provide services really well. There's less of a research focus compared to the psychologists. There still is studies on evidence-based practice, and there's some work around research within your MSW program, but it's not nearly as intense as it is for psychologists and students that are in those programs. So again, clinical abilities there still really high. There's a lot of social workers doing therapy in our community in particular. And there's a lot of psychologists. We live in a wonderfully rich community for mental health, which is awesome. Erin, I think you were going to say something.
Yeah, I'm not sure if this maps on with your experience, but I've always been told social workers are better at knowing the community resources in terms of referrals to other services that you might need. I think you guys get better training in helping people get connected to other things that they might need besides the therapy itself.
Sure. Yes, I would agree with that. Yeah. Yeah. And I know we have some questions in the chat. Maybe we can run through these other topics and then answer those before we move on. So there's also licensed counselors. So you would see the LPC and the LMHC after their names. The LMHC is a licensed mental health counselor. Erin, what's the LPC? I can't remember off the top of my head right now.
Licensed professional counselor. It's similar to the distinctions between the two social work degrees. Both are licensed counselors who are well trained to provide you with therapy services.
Yeah. And sometimes you'll see multiple things after someone's name. I should add that, because even within the social work world, there's different certifications and licensing that people can get. Again, a lot of that's around billing. So if you've ever seen R, that's about how they can bill people. But it's just something to be aware of. Yeah. Should we open? Let's see.
And then there's also licensed. Oh, sorry.
No, go ahead, Erin.
I think we've got a little bit of a lag going on. I'm sorry. Okay. There's also licensed marriage and family therapists who are, again, master's level, licensed to practice therapy. They just specifically focus in on seeing people in a more families and couples perspective. They will typically not see individual patients. And the note I wanted to make on unlicensed therapists is to be very cautious there. People who are life coach, who are therapists, but without any of these letters at all, any kind of licensing or certification, you might run into people like that. And some of them might be good people, well-meaning, who can help you, but some of them, there's just no accountability in there without the licensure process. So you have to know what you're getting into with that. Might not be the same standard of screening when you're seeing somebody licensed. So I typically advise away from seeing someone who's unlicensed, again, unless you're okay with taking on that risk and using your judgment to make sure that you're not gonna get swindled by somebody who doesn't know what they're doing.
And Erin, if I can just add to that a little bit, I think these other areas also, we have codes of ethics that we follow. We have requirements around HIPAA and confidentiality laws. And I think that that's what you get when you have somebody who's licensed, in addition to hopefully good practice and a good relationship. So the first question that Rocio put in the chat was, can a psychologist prescribe medicine? Erin, do you want to answer that one just because you're in the psychology?
Sure. So currently, no, psychologists cannot prescribe medication. There is a movement in the field where some people are trying to advocate for psychologists to be allowed to prescribe, but at this point in time, no, psychiatrists and medical doctors are the only ones who can prescribe, not psychologists.
And just to add to that, and I think this leads to Brenda's question a little bit. Brenda asks, will a psychologist, social worker, or counselor collaborate with your primary care doc if meds are determined need? Yes, yes, yes. There are many medical professionals who actually like really highly recommend it and say that they want to see both going on, right? That they will prescribe medication and they want some support around therapy. And so yes, lots of collaboration can happen. Of course, that assumes that the client signs a consent for release of information on both ends, but typically that is our practice. And so, yes, that does happen.
Yeah, absolutely. Especially if it's a primary care doctor who wants to see that you are diagnosed by a professional and working with a professional, we absolutely collaborate across. So definitely a yes on that one. Okay, any other questions on this piece before we move along to the next topic?
No, that was a really good overview, though. Thank you.
So Erin and I can probably both geek out a little bit on different therapy approaches and get a little like wordy with these. So we're going to try to really distill them because they're complex and there's different approaches within these approaches, honestly, and there's different practices and interventions within these approaches. And you know, as someone who works with kids through adults or who has worked with kids through adults, you know, my approach, if I'm doing, I typically am a CBT practitioner, so that's my training. That's what I mainly do when I focus with people. I have some training in some other areas, but that's the way I practice. But obviously, it's really different if I'm working with a grown-up compared to an 8-year-old, right? Even an adolescent is going to be really different for me. So this is just kind of some framework for what these therapy approaches are. And what's important about them, just to give some background, is if somebody's seeking out therapy and you think one of these approaches is more what you lean towards, you can look for someone with that practice experience. If you're not sure, then that's okay. You can always try something out, and we'll talk more about the therapy experience in a little bit. You don't have to study these in order to determine what's the best fit for you. So that's just something to know, but they do exist. These frameworks exist, and there are therapists that practice with more than one also. So cognitive behavioral therapy, I feel like I almost can't say it without making a triangle, because that's how when I work with children, that's often what I do. Because there's a connection. The focus of this is there's a connection between what we think, I always do my triangle kind of up here, to how we feel, and then how we behave, how we act, what we do. And there's a lot of focus on our thoughts and recognizing that sometimes we have really unhelpful thoughts, or we have thought distortions, or we get into thought traps, and that we want to work towards having some more balanced thoughts that are more helpful for us. So that's kind of like a little bit of that overview. There are strategies and tools to get there. It's not just suddenly you hear that and you have this awareness. It's something people continue to work on, and find what situations are harder for them, right? When is it a difficult time to actually have that awareness and to work towards adjusting or changing or adapting our thoughts to where we are. Even within cognitive behavioral therapy, there's also sometimes acceptance of the feelings that are going on. And again, an awareness of our thoughts that are kind of keeping us from accepting even some of those uncomfortable feelings, right? So, Erin, I don't want to jump ahead if you have anything to add there about CBT, but I just wanted to kind of give that overview there.
Yeah, I would just note CBT tends to be very goal-oriented. Often there's more of a short-term focus there, but not always. And then also CBT has a great research base, so there's a lot of evidence that shows CBT is really helpful. So that's all I would add there.
And so just with that piece also, there's like trauma focused CBT, which is a TF-CBT you might see if somebody summarizes that's something that they work on that's specifically for individuals who have experienced trauma. It can be helpful for people with various needs CBT. It does serve a broad range of clientele, and there is good research and evidence about its effectiveness. So then there's DBT, dialectical behavioral therapy. And this is it kind of like, I put a type of CBT, although I'm always a little bit cautious there, but I know it grew out of from a CBT practitioner is kind of who helped launch CBT. And there's growing research to support the effectiveness also with dialectical behavioral therapy. And the focus with dialectical behavioral therapy is on, it's incorporating mindfulness, interpersonal effectiveness, distress tolerance, and emotional regulation. So it's not, so it's kind of combining a lot of that. And there's really all of those components. It's what I like to say is, it doesn't just talk about them. It's not just like thrown in there. There actually is that practice. Often DBT has an individual component and a group component, because the individual part is where the therapist and the individual can work through some specific things that are going on with their own lives and experiences. And then the group component is a way for people to share with each other and give some support around that. Sometimes it's hard to get both of those, I will say that. So you may find a therapist who's going to do individual DBT work with you. And then sometimes in the community, we learn that there are DBT groups being offered. And people really tend to look forward to those and like those because they're supportive as well. DBT has been shown effectiveness also for various needs. Borderline personality disorder is one of the big ones that kind of comes out as being, that's part of where DBT came from, is that was a difficult diagnosis kind of to treat. And DBT was shown effective for that. One thing I just want to point out with dialectical behavioral therapy, it sounds so technical and official when you see dialectical in there. And I really enjoy learning about this idea of the dialectical thoughts. So it's like, even with CBT, we talk about all or nothing thinking and how we can get stuck in that always or never, right? It's hard to get to that middle ground, that gray area. And dialectical behavioral therapy does some focus on that, right? So you could say something like, I care about my best friend, and I don't like that he nags me all the time, right? Like you can have kind of both those thoughts and feel like acknowledge that for yourself.
All right. Another type is psychodynamic therapy. This is probably what comes to mind for a lot of the general population when they're picturing therapy. This stems from the original Freudian work from our psychological history. It has evolved since those times for sure, and it is not exactly what Freud was doing back in the day, but it is that more focus on your past and how that shaped your present type of experience. So if you're someone who's looking specifically to gain a lot of insight into how did I end up here? How did I become this person with these symptoms and who reacts in these ways in these situations? Psychodynamic therapy typically does more of a deep dive into how your parents led you to behave certain ways with the way that they raised you, how maybe your experiences as a kid with your friends and your schooling led to the way that you act now. So there's a lot more of that focus on gaining insight into why you have become the way that you have. And I think a lot of people think that most therapy is like that. And you don't do a ton of that digging into your past in like CBT or DBT. There might be definitely some acknowledgement that that's something that happened, but less of that really diving into those patterns from your past. So that's why I call it insight oriented. It's a lot of how do I understand myself? And they try to create corrective experiences through the therapy relationship. So if in your past you felt rejected all the time, a psychodynamic therapy will try to provide you with experiences of acceptance. If in your past you felt like you weren't listened to, a psychodynamic therapist is going to try to be that person that listens to you. It's less structured. It's less of that, like we have this goal that we're working towards, and more exploratory. And often very much driven by where you take the conversation. So the therapist takes more of a back seat and the patient talks and then it goes wherever you take it. So definitely different from those other approaches in the amount of structure and the amount of goal focus. Anything you would want to add there, Melissa, before
No, I keep thinking, there's sometimes this element of like role playing that goes on, although that can go on in other therapies as well. So I don't mean to say that's the only place that could happen, because I mean, even with DBT, as we're working on interpersonal relationships, and stress tolerance levels and things like that, and same with CBT, it can come up. But I do think of that also often when I think about psychodynamics.
All right, and then there's also humanistic therapy. And the approach that a humanistic therapist takes, the stance that they come from, is that every person has it within themselves to achieve what they want to achieve, to self-actualize, so to find their sense of purpose and happiness. And they're really going to look for your strengths and for you to find it within yourself to know what you need to do. Again, taking a little bit more of a backseat, because their stance is, you know what you need to do, you have the tools within yourself. There's a lot, again, of that exploration of yourself here, of helping you find your own resources, find your own strength. And humanistic therapists are very big on unconditional positive regard and empathy. So they will support you, they will provide a lot of empathy. But again, if there's something that you're really working toward, you want to be working towards a specific goal, you want someone to give you more structure and accountability, there's a little bit less of that here, because it's more of that supportive approach and more of that exploratory type of approach. And then I just wanted to note that not all therapists stick strictly to one of these. In fact, like, more and more therapists are not sticking strictly to one of these. I typically don't have just one approach that I use all the time with everybody. I might start with doing some CBT, and if that's not working for you, do a switch into some DBT. We might work through some CBT work, and then if you express you want to do some more of that exploring into your past, I might shift into more of a psychodynamic mode for a little bit. So it's not that every therapist just has one of these that they do. Some therapists do have just one that they do. And so you might see someone describing their approach as integrative, eclectic. That typically means they're pulling from multiple of these models and adjusting their style based on either the patient preference or what's happening in the room at that time. And these are not all of them either. There's a lot of different therapy approaches out there. If people have questions at the end about any more that they've heard of and want to ask about, we could talk about those as well. These are kind of the main ones that stand out as the most popular among therapists.
And then just to add, there's different modes of receiving therapy: individual therapy, group, which can vary in size. And there's different types of groups, whether they're a closed group or an open group. So that's like established ahead of time. But that means, is it a fixed set of members that attend that group, or can it be, can different people join at different points and not attend? Couples therapy, family therapy, how the family is defined for family therapy, just to add that. Outpatient therapy is when you would, attend at a clinic like Mindwell. Inpatient is if you're staying in like a residential facility or in a treatment center. And partial may have kind of a combination of those. So we wanted to chat for a moment about myths and facts about therapy. And obviously the illustration is hopefully a myth. But just take a pause from Erin and I speaking for a little bit to see, not even if you have a question, is there a myth you've heard of about therapy and you're just wondering, is that true or not? And perhaps we can provide some insight to that. So I know Erin brought up kind of one before, like, do I just go and lie on a couch and tell you about my dreams, and that's one I would say for the most part, that's a myth, right? Like, there could be practitioners out there that do some version of that, but and couches may be available, and most of our offices are there. Typically people are sitting up in them, I'll be honest, not lying down, but I imagine that there's some flexibility there.
I get
Any of
very
it.
frustrated with the way therapy is often presented in the media, on TV, and in movies because it's often so inaccurate. And I'm like, I would never say that to a patient. What are they doing? And so I think there's a lot of myths out there about the way it works, for sure.
Well, we can save them for the end too. Oh, Monica, were you going to ask something?
I was just trying to put into words what I was thinking, but let's go to the end because
Okay.
I'm trying to formulate a thought
Mhm.
and it's not
Yeah. Okay.
it's
I
not
will
there yet.
add one thing that also comes up about myths is like boundaries, right? And
Yeah.
so often, again, in like TV shows or that boundaries are crossed all the time, right? These other relationships happen, communication outside of a therapist's office, things get shared. What can be shared, what can't be shared, all of that comes up in a very different way than reality, I would say.
Yeah, absolutely. These TV therapists have no ethics.
Kind
But
of
they
like
get
the
paid a
TV
lot more than
doctors.
us.
Yes, like the TV doctors, no ethics at all. Okay. So we wanted to talk a little bit about like, okay, what happens? What should I expect when I get there? Because I think sometimes the unknown element makes people not want to go because they don't know what to expect. They don't know if it's for them. They're just nervous about all of the unknown. So what do you do? What happens when you get there? So starting at the very beginning, to make an appointment, typically you have to call. Some therapists, you can sign up for an appointment on their website, but usually you would call the number to make an appointment. And in that initial phone call, they'll probably ask you a couple basic questions. So, what are you coming in for? And they're not expecting your entire background, whole life story there, just a couple sentences summary of I've been really stressed about work. I think I might be anxious. I want somebody to help me find some tools to deal with that. So, a quick summary of why you're calling. They might, yeah, I see the comment in the chat. Absolutely, having to make a phone call is a big hurdle for somebody with phone anxiety, for sure. I cannot express enough how much it takes for some people to even get through the door to that first appointment. So
Yep.
it's a big step. It is definitely a big step.
I'm just thinking there's a lot of parallel between it's hard for people to walk in or call the Cancer Resource Center as well because they don't know what to expect.
Absolutely.
So I'm seeing a lot of kind of some parallels here. So
yeah.
I know.
So
Oh, sorry. Just with that piece of it, just to go there for a second. Sometimes having a loved one nearby, somebody who is encouraging, even putting it on speaker so that they could like help talk through some of the things at that moment. As a social worker and like my role in the schools, I've sat with families even and supported them in that process. I know some primary care physicians might do that as well, or call ahead sometimes, or send a referral over so that it's expected and so it's not so hard. But it is hard. It's an intimidating step. It's it can be tricky. I totally hear that.
I would recommend, if you're really nervous, having notes for yourself to look at when you're calling. Maybe if you're worried about explaining what's going on, have those couple sentences description written down so that you have a plan for what you're going to say. And again, they might ask you more questions, but at least then you have a place to start. You have a plan. Especially like if you might have to leave a message, sometimes like knowing what you're going to say in the message that you leave can be helpful. If you have to follow a script to get yourself through that first call, you've got to do it. And so I think that's definitely an option.
And one more thing with that one, there's no right or wrong reason necessarily for getting therapy. So if it's something that you're feeling is right for you and people that you love or care about are encouraging you, you don't have to say, I have this diagnosis, that's why I need this. That's not a requirement. So it's really a no judgment acceptance, and then you can, figure it out with your therapist on how it can be helpful.
Yeah, absolutely. I think it's part of our job to figure out if there's a diagnosis involved. So we don't expect you to know already whether you have something. So definitely. A lot of people call, say they're stressed, they're overwhelmed, they're having difficulty coping with some situation or another. So there's not something that's not a good reason. So absolutely anything, whatever it
So in
is,
other
at
words,
least give them a call.
Yeah, it doesn't have to be a complicated, it can just be, I'm overwhelmed, I'm burned out, I'm okay.
Absolutely. Yeah. And a lot of therapists like to see somebody getting in there who maybe isn't sure if it's right, so we can help you before things get worse. So that's great. I would love to help somebody who's feeling a little overwhelmed and get them on the right track. Or if it's something more serious that you've been holding back on trying to get therapy for years, definitely don't have that concern either. No matter how simple, no matter how complex, there's some therapist who is a good fit for whatever it is you're looking for help with. So yeah, on the phone, just basic questions. They might ask, what are you coming in for? They might ask when you're available for an appointment. They might ask what insurance you have, like name, date of birth, but typically, again, just some very much basics. You're not going to be expected to do a whole in-depth background on everything on the phone, but do be prepared to answer a few simple questions about what's going on so that they can see if you're going to be a good fit for that clinic. And you might be asked to fill out paperwork ahead of time as well. So they might send you different consent forms, especially now with telehealth. Usually there's paperwork we would have you fill out in the office. They might send them to you ahead of time. There could be some consent forms. Some people will have you fill out like a history form or different symptom checklists to measure and screen for different things. So you might have to fill out some paperwork ahead of time. And leading up to the appointment, typically the first phone call and maybe some paperwork, and then you're good to go. You might be put on a wait list for a while at different places. So that's something to be prepared for, is for maybe the first person you call to say they have a wait list and know whether that's something that you're willing to say is, yes, put me on the wait list, or I'm going to call around and see. Unfortunately, there are a lot of therapists in the area who do have wait lists right now.
Question about that, Erin. Even the intake call can be a wait period. So for Mindwell, I just filled out a form for my husband, and it's like the first appointment's in May, late May. And that's just for the intake call. In that case, I mean, what if someone's in crisis? How do you get an intake sooner?
Well, I mean, I will say, if it's one thing that our community has, it's not Mindwell necessarily, but Tompkins County Mental Health can see people in crisis. They have a mobile crisis unit. They also see, they have a quicker turnaround. They have to, because they're a public mental health agency. Their caseloads are really different than typically other agencies. So that's just awareness. And they sometimes have to prioritize and really triage who they see with, weekly, let's say. And that exists. So that is always an option. The wait lists are awful. And it's actually but one thing Mindwell really, just because we can both speak from Mindwell, that's something we're really working on, and they're hiring as frequently as they can, and trying to really incentivize people to come work there, because it's hard. And I think right now, even just in our community for children, I can speak from a school social work perspective, it's especially hard. Because there's some practitioners who really won't see kids, and they focus on adults, and there's limited numbers right now who can serve our kids, and it sounds like even adults. So with that, I would say keep calling around. We could provide some support there too, but it's and shifts happen too, like wait lists are best predictions, right? Like it's unclear sometimes of when movement will happen. But
okay, good to know. Thank you.
And I do want to say, yeah, in a true emergency, the hospital is the best way to go. Like, obviously, not all crises are the same, but if it's a true emergency, a hospital, there's also different crisis lines out there if someone needs someone to urgently talk to right in that moment. But again, if waiting is possible, getting your name on some wait lists to at least be considered and ready to go. I see we have another question, so go ahead.
Yes, yes. In addition to what Brenda was saying, I just want to add how frustrated it could be when we make a phone call and we want to complete intake forms, but we also want to know if the person that we're calling is capable of helping in the problem that we're having. I remember I was helping a few years ago to a friend of mine who were looking for a specialist in eating disorders, and everyone that we called it was taking intake forms and forms and forms, and we couldn't talk to the person to see if that the therapist was specialized in that problem. So months went by, literally one another, and it was so frustrating, until she had to go directly to the hospital. It was terrible because we want to know if that therapist that we're calling for from to get help from, is actually has the experience that we need for the problem that we need. It's hard.
That's really hard.
It is
And
hard.
Rocio, in that area in particular, I think that is hard. I've worked to help individuals and friends with eating disorders, and there's a limited number of people that really say that that's a specialty of theirs.
Literally
And so it's
months, because we were all getting involved, calling this person, and it was like we had all my friends' information so we can complete and answer all the questions that we were being asked. But we wanted to talk to the therapist and say, do you have experience in eating disorder, period? And someone like, oh, no, I don't. After hours of being on the phone, it was frustrating, but, I think it worked out well at the end, but it was a large journey.
Yeah, eating disorders is an area where there's particular difficulty getting appointments, in particular need for more therapists that can work with that. I hear your pain on that. We've really struggled to find people who can fill that need.
I know. Well, thank you.
Mm-hmm. Okay. Yeah, definitely. Thanks for participating. That helps kind of get the conversation going, and we want to hear all your questions, especially. So when we'll move through this last bit and then move into questions and answers more for sure. So yeah, the first appointment, just wanted to say, is typically focused on gathering information, asking questions about your history, your problem, what's going on, screening for different symptoms. So usually that first appointment is just around that information gathering. So I think some patients are often disappointed that they're not getting the actual therapy, actual help right away in that first appointment. And so just something to expect is that first appointment might be mostly just the therapist getting to know you, getting to know what's going on with you so they can come up with a plan. I will say this first appointment is absolutely a good time for you to ask questions you have about that therapist and their approach, for you to go into it thinking, okay, I want to figure out if this is a person I want to work with, if this is a person who's going to be a good fit for me. So it's not just a time for them to get to know you, but for you to figure out, am I going to be comfortable working with this person? Is this somebody who's going to be a good match for me? So that's kind of usually the first appointment. And some therapists might spend a couple appointments on doing some of that assessing and figuring things out. Some, it's just the one first appointment. But just to expect that at the beginning, there will be some more time on evaluating and assessing. And then what happens in therapy itself is kind of our next question. Like, okay, you're there, you're in therapy. What are you going to have to do? What happens? What is going on there at all? So lots of different things. And again, that kind of varies by the approach, as we said. Some are more focused on specific skills and tools. For example, when you're experiencing this symptom, here is a specific thing you can try. Some is that supportive, non-judgmental listening, having someone who's going to just be there and hear your problems without putting any of theirs back on you and just support you through whatever it is you're going through. Processing difficult things going on with you. If they diagnose you with something, they might provide information about that diagnosis, provide information about symptoms, even if there's not a diagnosis, about mental health from kind of that background of learning that they have, for you to learn more about what's going on with you and come to an understanding of it. they might ask you to set a goal and check in with you every week about your progress towards that goal. Or again, there could be some of that more open-ended, guided exploration. Anything you want to add, Melissa, on things we
No,
do
I
in
know a
therapy?
lot of therapists are adding in more mindfulness into their approaches, even if they're not strictly a DBT practitioner. And that's based on, again, what an individual wants or feels comfortable with, and exploring that a little bit more. But it's been, again, there's evidence that shows that can help in various modalities, as well as for different symptoms and different life experiences that are going on. So I know that that's happening in lots of different ways for all ages, honestly.
And next, we just wanted to give some advice on, like, how do you get the most out of therapy? How do you try to get a successful therapy experience that you're going to feel good about? And these are just some of our suggestions, but we can talk through, again, questions and comments anybody else has as well. I think first piece I want to say is finding that right therapist for you, like we talked about, of going into that first appointment open-minded of, is this somebody who's going to be a good fit for me? Because not every therapist is going to be the right therapist for you. We're all people with our own approaches, our own personalities. And so trying to do some of that research on finding who's right for you at the stage of looking at their websites, of looking at how they describe their approach, and at the stage of meeting them and getting to know them a little bit.
And if it ever feels like it's not a right fit, you know, the hope on the therapist end is we could have an open conversation about it, but you are allowed to end that therapy relationship and find a different one. Like, you always have that, just like with any practitioner in your life. I think people feel sometimes obligated, or like they can't do that. And I've had people come to me and talk to me, not even as a therapist, as a friend, asking like, is it okay if I don't think this is really the right approach for me? And I say, sure, if you're really aware of that, of course it is. So know that that is okay. And it's important to recognize that for yourself.
And I would add, in general, knowing that addressing concerns with your therapist is part of the process and something that we want you to do. If we say something that you don't like, tell us. If our approach isn't working for you, tell us. That is like your chance to be completely open with someone, to tell them what's bothering you in an environment where you can expect that they should respond well, because it's their job to support you and be there for you and listen to you. So if something is not working for you, I want to know about it. And just about every therapist I've ever talked to agrees on that, of tell your therapist if something's not working, if you want to change the approach, if you want something different out of that relationship.
Yep. Great.
Yeah. Having a clear idea in mind of what you're looking to get out of therapy can help. So having a goal for yourself, having just some general idea of like, okay, this is what's bothering me and this is where I would like to go. This is what I would hope would be different. Again, you don't have to know exactly what's going on, and they can help you work towards knowing. But having a goal can be helpful if you are in an area where you know what you're looking for, and making that goal clear to the therapist, I think, is part of that.
And goals, you know, can be, there's different types of goals. There's like sometimes reducing certain things, growing more in certain ways, finding more exceptions to situations. Like, goals can be, you know, said in that those kind of ways, not just my goal is that I get that job, right? Like, that's not necessarily what we're talking about therapeutic goals. The other piece that I really want to point out from this slide is the commitment to putting in some work, because that's a level of engagement, and that's actually what makes therapy really work for people and helpful for people. And so if you're a person that's like forcing someone to go into therapy and they're willing to attend, that's awesome. That is a big step. And yet, if there's also not really this commitment to trying some things out that are being worked on, or even exploring why maybe you're not willing to try that out with the therapist, because that's also part of the therapeutic experience, is exploring like some of those challenges for yourself. It's going to be a harder experience, right? Like, showing up each week is really important for sure. And having some commitment and engagement beyond that is also really helpful for individuals.
Mhm. Yeah, therapists might assign take-home assignments for you to work on. And if you do those assignments, that's going to be great and that's going to get you going. We often say, like, we're with you maybe 1 hour out of your whole week. And so doing some of that work and practice on your own time can be really helpful. So knowing that it might be difficult and that therapy might take some work, and committing yourself to doing that work for yourself. And then I just finally wanted to say, therapy, it's your experience, that it's what you want it to be. So if you've got multiple things that you could potentially talk about and you're like, I really don't want the therapist to hyper focus on this one thing from my past, tell them, like, hey, this is a thing that happened, but that's not what I'm looking to work on right now. I want to focus on this. If
Right.
they're kind of pushing you towards one goal and you want to say, like, actually, that's not what's important to me right now. What's important to me is this other goal. I think it's important to know that you can advocate for yourself and make your therapy experience what you want it to be. They might encourage you and say, oh, it seems like that thing's kind of important. Are you sure? But at the end of the day, it's your therapy experience and you're not forced to do any part of it. And so making it what you want it to be, telling your therapist what's important to you, what you want to focus on, can be a good part of that process to make sure you're getting out of it what you want to get out of it.
And goals change too. The goals can change. So because our lives are changing and our experiences are changing and our stressors are changing and all sorts of things go on for us, that can shift. So even if you enter therapy set with one goal, you possibly that might evolve or completely change.
Mm-hmm. Yeah. And then we just wanted to hear any questions or concerns for you. This is your chance to ask a therapist any questions about what therapy is like, ask about any myths about therapy that you've heard, concerns about therapy that you have. We'd love to answer any questions that you have or any concerns that you have.
So, quite often we have, clients that are wanting to have someone to talk to about making decisions about their care. They've got the medical piece of information, but they don't have that emotional piece. Is that something that a therapist can really help them through, or do they need to talk that out more with their doctor, or what would be your suggestion?
So I think it's a both.
Oh,
sorry. I think it's not an either or. I think it's a both and kind of situation.
Okay.
I always encourage for the medical pieces for sure that they, somebody checks in with their doctor, has good information, knows options. Ideally, they also can share concerns and fears and things that are confusing, any other sort of emotions that are coming up with them, also with their doctors, their primary care or their oncologists or whoever they're seeing, a specialist. And I also think therapists can help with that as well, with not necessarily, again, it's going to more explore those feelings around what's going on and those thoughts that are going on. It's not like a therapist will hand that, that right answer over or anything like that. Yeah. And I think it can be a really healthy part of the healthcare, honestly, for an individual experiencing cancer, or a loved one that has, somebody that they're caring for. That's my thought. Erin, I don't know if you have something to add to that.
I was going to say something similar. Absolutely. We can help you figure out your emotions around decisions, guide you through a decision-making process, help you see what's pulling you in different directions. The only caveat is what I would add is what Melissa said of, like, if you're looking for somebody to give you an answer, therapists are really good at not telling you what to do and just saying, what do you want? I'm not going to give you an answer. So absolutely, they can help guide that process though.
And that's kind of the information I've given them, is no one can make that decision but you. But, I recently had somebody that he'd gotten all of the information from his healthcare providers, but I think he just needed somebody to talk it out. And I think, like you said, explore where he was coming from. So,
and there are tools and strategies we could even work on in therapy about problem solving and coming up with, thinking through different possible outcomes, stumbling blocks, things like that.
okay, good. Thank you.
I just had a recent situation where I had been overwhelmed with all this paperwork from different specialists and new oncologist, and I couldn't get to the paperwork, right? And I talked to my counselor, my therapist, and we talked about strategies on how to accomplish that, and it was really like next foot forward to help me do that. And so it is really good to hear, just having that encouragement, someone in your ring to, in your corner to really help make those next steps. Like Monica said, when it's someone challenged with a decision, or in my case, just trying to get over that next step of 32 pages of information to fill out for another doctor. It's really really helpful. Yeah,
I'm glad you had that experience.
I think a lot of people are concerned too that once they start therapy, kind of talking about those myths that they have to be in therapy for the rest of their lives.
Yeah, that's a great one, Monica, to bring up. And conversely, some people actually want to be in therapy for the rest of their life and don't want it to end. So I think sometimes there's that acceptance too of like, wait, I this doesn't mean I'm signing up forever. But I agree, Monica. I think that's a really good point, and that is definitely a myth, and that could be addressed too. And that's where some of the goal-oriented and evidence-based work can be helpful in seeing that. Something I talk about, I know with clients, is we're not saying that therapy is like, the goal is not erasure of like feelings, just like how that, cartoon said, I still have my feelings. What's going on here? It's how do you, work on tools, strategies, have a therapeutic process and relationship so that you can take that into your life. And when you are feeling ready, as well as your therapist, and you have had those conversations about terminating therapy, it's time to do that. And it also doesn't mean you can't go back at some point, right? Like, you might not go back to that same person. You might. There's no set rule about that.
Okay, very good.
Yeah, I actually find that myth particularly difficult when I'm like, you're doing great on your own now. Let's wrap up. And someone's like, wait, can I stay? Can't we just do this forever? Because that is an expectation a lot of people have. And my approach is, I want to get you to a point where you don't need me anymore, where you're able to through these things without needing a therapist.
Yeah.
And so absolutely, you're not signing on for life.
Because I hear that a lot I do what I call one-on-ones, but I'm not a therapist, and I'm like, whoa, that's beyond. I can help guide you, questions to ask and all that kind of stuff. So, but people will say, but once I get started, I'll never be able to stop. And I'm like, well, now I can say no. So, well, good.
Any other questions?
There's also the myth that people are going to be hypnotized during therapy.
Yeah.
I don't
That's
practice
pretty fringe.
hypnosis.
Most therapists will not. And if somebody tries to and you're not comfortable with that, then you find a new therapist, or you tell them, shut that down right now, because like I said, your therapy experience should be what you want and what you feel comfortable with.
Right. I'm trying to think of all the questions I have fielded over the years. So Rocio, do you have any other things that clients have asked you?
Well, more than questions, I have found difficult situations where I clearly know the person needs professional help. And it's hard for me to say, well, you gotta find professional help. So we have to navigate that conversation saying, perhaps you could benefit from talking to someone, not us, but in a different level, a professional that could help you. And it's like, and so we're seeing all kind of people and all kind of emotional distress, but there are some that actually need some professional support. And I guess we're there to understand our limitations as well.
Sure.
And I will never go beyond anything that I could not help with. So, yes, that would be the one that I have found. I have encountered a few people that I insist in a different way, or I suggest, or I strongly recommend you should, but they just don't know if they do or not.
Well, and Rocio, I think you may be bringing up or touching upon, there's like historically stigma around taking care of your mental health or having mental health needs, right?
yeah.
We're more likely to talk about having a physical health need, although sometimes those also are hidden, but there could be stigma. There's labeling that goes on around, people thinking this. There's cultural components there too, and cultural experiences. And so that makes sense to me too, that people would be resistant in that way, because I just think back to like old cartoons when I watched when I was younger, like about, like the crazies person or something like that, and all the labels that are put on people that might have to be in therapy, or like the image of a straitjacket, right? Or somebody locked in a room or things like that. And so there, those are extreme, obviously, but there is stigma around it, and stigma around needing that help. There's gender components to that as well. I know that I hear about as well. And so I think it makes sense that there's resistance there, and it's hard to break that. Or people do say things like, well, I have my family, they take care of me for that, so I'm fine for that, right? And I think about people going through cancer treatment, they have a lot to manage, right? So Brenda, you talked about that 30-page document, and then there's all these appointments you're going to, and following up with medication, and then the impact of some of that medication and treatment on the body and on the system, and how exhausting it can be. To then add another person to your world can be really like daunting, right? So I already have to keep up with all these people. I'll just talk to my sister when I'm having a hard day. Totally makes sense. And sometimes you do need that other person. And with the benefit of actually teletherapy right now, that could be crossing over finally some of the barriers, where people can do it, like Monica was saying in the beginning, from their own home, from their bed even, in the privacy of their home, that we may be able to help people more than we could have in the past. Because it's exhausting to go to another appointment. I've watched loved ones and people dear and close to me. It's really hard.
Yeah, I get that, one more appointment. And what's been nice is with the telemedicine, they don't have to get up and go. They just have to turn on their computer. So,
right.
And another hard thing that something like therapy it's not like you're going to go to one session. Erin,
right.
We talked about what that first session looks like. Like, it's not like you're going to go to that first session and be like, oh, I feel awesome right now. It's going to take some time, and that's hard.
Yeah.
You're right, because people go, well, I went once. Well, yeah. That's like saying I went to the oncologist once.
Right.
They told me what the game plan was, but we never got a chance to do it. So that's good.
Well, and if any of you have thoughts that you want to bring up to our, therapeutic community, like that you feel like therapists need to know more of, or something like that, always feel, Monica, feel free, if you get feedback from individuals, let us know.
Okay, I will. The one thing I can say about is in the Ithaca community, from other places I've lived and other people I know, people here are a lot more open to going to therapy. People are very open about talking. I've been working with this therapist, or I've worked with this therapist and I'm going back to them. Whereas other places I've lived, people just, it was much, if they had a therapist, they never talked about it.
Mhm.
Whereas here, not all, but there's more that will openly say, yeah, I'm going to see a therapist and they've helped me get through whatever, or giving me tools on how to handle different emotions. So
Yeah.
now we just need more of you guys, because there's long wait
I
lists
know.
everywhere.
I know.
Oh, it makes me so sad. I just wish I could see all of the patients on all of the wait lists. It's heartbreaking, and I know it's daunting to be put on those wait lists. And yeah,
So have you
I
found
think
that
it's worth
COVID,
getting on the list. But
have you found that with COVID, there's more people coming for therapy?
Probably for children, right? The students or young people.
I think so. I don't know statistically, I don't keep track of that, but I think so, like just from my observations, yes.
I'm just thinking, because it's just sitting back and observing, and even personally, there's just a lot more stress, and I'm a people person, so sitting here seeing people on a screen just doesn't work as
yeah.
well for me. So
Mhm. It's a real stressor on a lot of people, definitely. If somebody had been doing kind of okay, struggling a little, that was enough to kind of push a
Mhm.
lot of people to decide to take that step.
Yeah.
any other questions, Brenda?
It's interesting that you you came to me, because I've been pondering. Dave and I, my husband and I, have been talking about just an interesting question with regard to generational professionals, right? So I have seen a professional therapist who's much older woman, has many years of experience, and just curious about your thoughts, because there are a lot of young professionals in social work and mental health, and it's like, well, they haven't necessarily had the years of experience, but they have new skills. So what kinds of thoughts might you have about younger professionals in mental health versus the long haul professionals that you have encountered, different modalities, things like that? What are your thoughts on generational professionals?
Are you asking us because I'm old and Erin's young? I'm just kidding.
Melissa.
I don't know. I think you're young.
Well, Melissa and I are the same age, so we won't date ourselves, but I'm talking even more experienced elder professionals, for example.
Well, one thing to note with therapy, most therapists get supervision from somebody else in their agency, or maybe within like a different practice. So, ideally with that supervision comes, some understanding of the therapeutic process and the work that people do with individuals. So even though you're seeing one therapist, you're kind of also gleaning parts of what that person gets from supervision, from their own learning, from their own life experiences, sure. I find a freshness, honestly, in a lot of young professionals, and up to date research that I learned from, because I have to keep up with it on my own or through my professional development that I need to get for my license each year. But I haven't been in school for a while now, so I appreciate that, and I learn from older professionals as well. So I think it's same with like your medical community, right? That you're going to get doctors that are fresh out of med school and some that have been working in the field for a long time. There's benefits to both, but luckily they don't operate in silos. So that's kind of what I was saying. Like they operate within professional communities and clinics, and that's helpful.
Great. So there's a differing degree of sharing. That's good.
Yeah, I don't know if I'm biased as a younger person, but I do feel like there's the really experienced, really amazing older therapists, and then there's some older therapists who haven't kept up to date on the research, who haven't learned all of the newer techniques, and are a little bit outdated on their skills and knowledge. And so there's trade-offs to both, because again, the younger therapists don't have the experience, but do tend to have more of those up-to-date skills, like you said.
Yeah. Or just thinking about like, well, is that person going to understand the experience that I'm sharing about my situation? Because, you know, I'm in my 50s versus someone in their 20s, that kind of thing. But I think it's just all, you know, see how, like you said, when finding the right fit of a therapist, and that might be a factor for some people.
Sure.
Absolutely. I would add, I mean, again, while there's great therapists across all different demographics, it's okay to be specifically looking for someone who matches your preferences. A lot of people want someone who's the same gender, someone from the same race or ethnic background, somebody who's going to understand aspects of their experience. And that's normal and okay if you want to call somewhere and specifically say, I would like to see a woman, for example, or somebody who's going to fit a certain category you're looking for.
Like a matchmaking site.
Yeah. Even spirituality can come up. You know, spirituality comes up in therapy sometimes, and sometimes that connection is important to people, even if it's not someone with the same faith practice as them, that there's an openness to that within, you know, therapy.
Interesting. Thank you.
Well, we appreciate being invited to be here and the amazing work the Cancer Resource Center does for our community. I have benefited from it personally, and so I know, you know, through people that I care about and care for, and I as a social worker recommend it to people all the time.
Well, good. Thank you, because I'm doing it back to you guys. So
Yeah, don't want to downplay the importance of having peer support in there as well. I think in the types of therapy we went through, we didn't note peer support groups, but that is an incredible resource. And I think it makes a huge difference for a lot of people. So
I agree. Again, for individuals and for caregivers and loved ones.
It's made a huge difference for me with the Cancer Resource Center's peer support groups. And I'll tell you, it helps you get through a lot of things. Yeah. That's a great one.
Yeah, I mean, our groups, I think they're phenomenal. I know I'm a little partial, but just the amount of sharing and caring and support that they give to each other is just phenomenal. And it's kind of like, it's, you know, we have people coming newly diagnosed, in treatment, after treatment, years out, or when it comes back, and they all work really, really well together to support each other. And I think that's what makes the support groups work so well, is there's all kinds of experience and encouragement.
Yes.
So.
And I guess also because there is no judgment, you know, there's only listening, there is just caring and respect, you know, I think what has made us unique.
Yep. So, and also I will have a pamphlet that I can share with you, Erin and Melissa, about that we created 2-3 years ago, Rocio, on how to find a therapist.
Oh, good.
Oh, yeah.
There's some background here to it, but we finally got it out. But for those very simple questions, and I actually want to take some of your things and go back and look at ours to see, did we cover it all? Because you know, it was like what to expect for that first phone call and what to expect with the you know, first appointment. And so but I, you know, Melissa, you listed another list of possible, you know, therapist, the
Collaborative Solutions Network.
Yeah, I already closed my notebook. It's over there.
No, I have it here.
Okay, good.
I think we definitely can incorporate a lot of your presentation into the services that we provide, or maybe create a one-sheet document, or even in our website, because that will help people a lot, you know, just knowing the difference between the services and what the letters mean right next to the name, you know, because right there is like, what is this, you know? Yes, I think it will be important if we can do something like that, Monica.
yeah, we'll look at it. So, but I think, you know, and I'm just so glad you guys were willing to come. And I'm really sorry we don't have a larger audience tonight, but I have a feeling I'm going to have a lot of requests for the recording, because
Yes.
I can think of like probably 5 or 6 people that were going to come, but I guarantee you they're sitting in front of the TV right now.
Mhm.
Yes.
I don't
And
blame them.
it's an intimidating topic
Yeah.
to broach in a group setting like this. So
Yeah.
maybe watching it after the fact will be good for some people. And it sounds like you are going to take the information and spread it through the whole community. So I'm sure they'll get the information.
Well, you
Yeah.
know,
Well-
it's kind of like these workshops that I do, they're not only to inform our community, but it's to help keep us educated too about what's out there. And because I don't, you know, I can't learn it all, I can't do it all, but I can certainly, you know, provide myself with lots of good resources in the community. And so it's all good. It's all good. So
Thank you. It was so nice seeing everyone, actually. It's good. Very good.
yes,
Yes.
Thanks for coming.
Yes.
Thank you.
yes, thank you very much. And I
Thank
hope
you.
you guys have a great evening, and we'll get you out of here at 7 o'clock so you can still go back, have a little bit of an evening tonight. So
Thank you very
so
much.
much.
you're so
Thank you.
welcome.
Have a
Bye.
good night,
Okay.
everybody.
Nice
Bye-bye.
meeting everyone. Bye.
Bye. You want to stay on for a minute? Oh, no, never mind.